developing world, cataract is the major cause of blindness, and it's kind of sad. It's just because they have folks over there have limited access to health care. It's not unusual for a young person to come with bilateral white cataracts, which are blinding. Couple that with the fact that there are really poor resources available for those that are visually disabled, and you get the sense of how bad the problem is. Cataract surgery is a 10-minute operation. We generally replace the cloudy lens or white lens with a clear plastic lens implant. We do it under local anesthesia. The recovery is rapid. It's a highly successful surgery. It's one of the more common surgeries done in the United States. That 99% of people do great, and it's truly life-changing, as this post-operative patient is sharing with you. I'm having a little trouble here. Let's go there.
Here you go.
So the wear is we generally do these missions in poorer countries, obviously in the developing world. Nicaragua is the second poorest country in Central America. The median annual disposable income is $200. The access to health care is quite poor. They've made strides in the last 10 years in terms of the current political environment is giving more resources to poor. The healthcare is better, but in a certain respect, they're still recovering from the major earthquake they had in 1972. This is the cathedral. It's in downtown Managua. It still hasn't been remodeled. It was one of the few standing buildings after that horrible earthquake that happened right before Christmas in 1972. You may remember the earthquake. That was when Roberto Clemente, the famous baseball player, tried to fly from Puerto Rico to Nicaragua with aid supplies, and his plane unfortunately crashed, and he died. So this is just outside of downtown Managua, and you can see that it's still recovering from the earthquake. The buildings are still lean-tos. We work at the only eye hospital, only state-run eye hospital in Nicaragua, in Managua. And this hospital was closed in the mid-90s because of a horrible outbreak of endophthalmitis. I mentioned to you the 99% success rate with cataract surgery. Well, there's a small chance of an infection. These infections, if they get inside the eye, can be devastating and result in permanent blindness. Well, they had an outbreak of contaminated equipment in the mid-90s. The local ophthalmologists were thrown in jail. I think 30 or 40 people lost their vision from the endophthalmitis, and the state decided to close the eye hospital. So you couple poor access to health care in the only eye hospital in the country, and you create this huge backlog of patients that are blind in a very treatable manner. So